Hi everyone, welcome to the National Counseling Examination Exam Review. This is Dr. Pepe. We are doing 5-minute videos in order to review the different domains. And today we are under Domain 2, Intake Assessment and Diagnosis. And we are in subcategory H, determining the level of care that is needed. Now, before we get into how to determine level of care, let's first talk about the different levels of care in the mental health treatment. These levels of care can be confusing. Many times, patients may not understand the different levels of care. So, as clinicians, it's important to educate and help the client understand what are the different levels of care and what are some of the pros and cons in regards to the level of care. So, the most intense level of care, and this is usually done in a hospital, is inpatient treatment centers. These are centers that, in an inpatient, they have the highest level of care. They provide mental and physical stabilization, and usually these are during acute episodes. Also, during inpatient level of care, there's usually an emergency situation, such as a suicidal attempt, overdose, and they need to regain whether it's physical stability, mental stability, detoxification. They need to gain that stability, and that is why they require that highest level of inpatient care. The goal of inpatient is to assist the client in stabilizing, and usually this is done through the care of medical professionals. Usually there are psychotropics involved. The length of inpatient varies, but it's usually a short term inpatient stay. And then for average, we're looking at anywhere from 2 to 7 days. If some diagnosis may require longer, such as if the client has an eating disorder, then it may require more days for that stability, whether it's through nutrition, force feeding, to stabilize. But usually it's within that range, give or take the diagnosis. The second level of care, that is not as intense, is the residential level of care. So usually during residential, it can average anywhere from 7 days up to 90 days, depending on affordability and the cost. Usually during residential, the goal is again to stabilize, as well as to now provide skills for recovery. So you may see counselor, psychologist, psychiatrist. You may have a schedule such as individual counseling, group counseling. You may have a nutritionist. And usually during residential levels of care, you come up with treatment plan and treatment goals for that specific stay. And with inpatient and residential care, normally you are staying in a facility for that period of time. The next level of care is partial hospitalization. Partial hospitalization can vary, and this is just a couple of hours each day. So you'll go from 9 to 1 or 9 to 2, depending on the hospital, and you'll have a specific schedule. Each hour you'll understand, where you're to be, and again, the goal is to provide skills. So letting, working with, whether it's trauma or working with, trying to provide that stabilization. The next one is intensive outpatient, or IOP. This is where a client comes into the treatment facility, and they come in, usually anywhere from 2 to 5 days a week, and they come in for a very specific purpose. So whether it's individual therapy or group therapy or meeting with a psychiatrist, and finally the last one is the outpatient, and that is where you go to an appointment, um, whether it's a psychiatrist, a therapist. So again, the most intensive is the inpatient, then it goes to the residential, partial hospitalization, intensive outpatient care, or intensive outpatient, and then finally outpatient. So those are the different levels of care that you should be aware of.